Have you ever felt like a bad summer flu that just wouldn't go away? And what if it wasn't the flu at all, but it was the first warning signs of Lyme disease? And what if by ignoring it, you set off a chain reaction in your body that could last for years? And that's what I wanted to walk you through, the Lyme disease timeline and what happens in your body when you catch it early, what happens when you miss it, and what you can do right now to stop it from becoming chronic. I'm Dr. West, the founder of the West Clinic in Pocatello, Idaho, and for the last 25 years, I've helped thousands of people recover from chronic Lyme, and people who are told by their doctors, your labs are normal, or it's all in your head. And in this video, you'll learn exactly how Lyme disease unfolds over time and why ignoring the warning signs is so dangerous, and how to turn your immune system back on before it's too late. So let's start at the beginning, the tick bite. Now picture this, you're outside camping or hiking or working in the yard and a tick bites you and you may not even notice it. Within 24 to 48 hours, that Lyme bacteria, the Borrelia burgdorferi, moves from the tick's gut and into your bloodstream. And some people develop that classic bullseye rash, but less than half ever see it, and most people don't even know they've been bit by a tick. Instead, they feel like they caught a summer flu. Low-grade fever, chills, fatigue, joint stiffness, and maybe even brain fog. And most people shrug it off and go back to work, but here's the danger. This is the best window for treatment. You see, when you ignore it, the infection doesn't disappear, it spreads. It starts moving through your lymphatic system, which is one of the most neglected organ systems inside of traditional medicine, and then the muscles, joints, and organs. It's like termites in your house. You don't see them, but they're already eating the foundation. And if the infection isn't addressed, it enters what we call early disseminated phase. Now, it spreads through your bloodstream, can set up camp in your joints or your heart, and it loves to attack your nervous system. You might notice migrating pain, like it hurts in your knee one day, your shoulder the next, and you may experience nerve tingling or dizziness, or feel your heart beating. Some people develop anxiety and depression seemingly out of nowhere, and this is a stage where misdiagnosis is common. Patients get labeled with fibromyalgia or chronic fatigue, anxiety disorders. Sometimes it's a hormone imbalance like menopause or thyroid disease, but what's really happening is this. The immune system is overwhelmed, and the body soldiers, your white blood cells, they can't tell the difference between Lyme bacteria and your own tissues. And they start fighting everything. And this is where I tell patients, it's not that your body is weak, it's that your immune system intelligence, it's been hijacked. And now we move into the chronic stage, the one that ruins lives if ignored. And that bacteria has learned how to hide. They form biofilms, intracellular infection, immune system cells, they avoid them from reaching them. And your immune system, it's exhausted from the constant battle and it starts to malfunction. You might even develop arthritis, neuropathy, memory loss, extreme fatigue, or hormone imbalances. And the infection can inflame your thyroid, your adrenal glands, and even your brain. They call that myalgic encephalitis. And that's why the chronic Lyme is called the great imitator. It can imitate or mimic MS, lupus, arthritis, depression. And left untreated long enough, it can cause permanent tissue damage and emotional collapse. But here's the hopeful truth. Even at this stage, healing is possible. We've seen people recover after 10, 15, even 20 years of chronic Lyme. And when we rebuild the system that Lyme has broken down, you see, ignoring Lyme is like letting a spark turn into a forest fire. At first, it's infection. Over time, it becomes immune disorder and a hormone disorder. And eventually, it can be a nervous system disorder. And the longer that you wait, the deeper it roots itself in your body's communication network. And that's why fixes don't work. You can't just kill the bug. You have to restore the terrain, fix the imbalances, remove the barriers to healing, look at your immune system, clean out your system, work to reset the nerves. And see, at the West Clinic, we developed a 3-step strategy that it helps people at every stage of Lyme. Like step 1, you got to rebuild the immune system, especially lymphatic system, work on your thymus and your spleen. We use targeted nutritional therapy and the thymus and spleen protomorphogens, oxidative medicine, high-dose vitamin C, ozone therapy, peptide bioregulators, and cellular extracts to help wake up the body's defenses. And then we want to help clean or vacuum or drain the swamp. We want to drain and detoxify. So that's the lymphatic system, the liver, the kidneys, and the skin. And we want to use natural drainage remedies, hydration, gentle movement, because if you have a clogged system, like you can't heal. Then we want to reset the nerves. That's through something called neural therapy. We help the body's communication lines reconnect so that the immune system and the brain are finally speaking the same same language again. When you treat the terrain, the body can finally heal itself. Now, if this is resonating with you, tell me in the comments below, like how long have you been fighting Lyme? What symptoms is driving you the most irritated or most crazy? And while you're here, hit the like button and the subscribe. And if you click on the bell, you'll never miss an episode. Now, every week we're sharing new ways to restore hope and rebuild health, and we do it naturally. Whether you're in week 1 or year 10, we don't want to ignore the symptoms. Lyme disease doesn't just go away, it adapts, and we want to adapt with it. And in the right approach, I believe you can totally become normal. That doesn't mean that the infections go away. It just means that it's dormant or it's hidden. There's a whole reason behind that. If you're ready to start the healing journey, you can visit www.lymefighter.com. You can download my Lyme Fighter Guide and schedule consultation with us to design your personal recovery map. Remember, you're not your diagnosis. You're your healing potential, and let's help to the body to heal. Being in the trenches for a long time, I get questions about really common. Like here's a couple of them. Hey, Dr. West, if I have had Lyme disease for years, is there really any hope that I can still heal, or is that damage permanent? We want to remove the barriers to healing, put in the building blocks, reset the nerves, and absolutely there's hope. I've worked with patients who were sick for 10 or 15 or 20 years, and they were told there's nothing left to do. But once we reactivated the immune system, cleaned up the terrain, and reset the communication pathways, we had some really neat healing begin. Like you can see Angela's story, you can see Lily's story. Like right here on the channel, I have these amazing patient success stories because the body doesn't forget how to heal. It just needs to be the right signals and support. Another question I get asked all the time about biofilms. What are they? How do you treat them? How do you break them down so that they actually, the treatments work? So biofilms are like these slimy protective shields that the bacteria use to hide from the immune system and the antibiotics. Think of them like a microscopic fortress. We use a combination of specific enzymes, and nattokinase is a really good one. Also using something called Spanish black radish and lomatium, IV vitamin C treatments, oxidative medicine, and getting the lymph nodes to change by using a mineral and part of the digestive system to change the hydrogen ion content structure in the lymph nodes and get that system to drain. Now, it's not just me making that up. Like I actually follow a protocol of 3 years of hydrochloric acid therapy. It doesn't take 3 years. It just explains someone treating chronic infection for 3 years and what happens when you get that contamination out of the lymph nodes. Now, once those barriers are down, like your immune system and those targeted therapies actually reach infection. Another question I get answered, what is neural therapy and is it painful? So neural therapy is a German technique where we use small injections like Botox needles, usually of a type of paraaminobenzoic acid or sometimes a local anesthetic, and it's into specific areas where the body's electrical communication's been blocked, like scars, trauma, or even nerve clusters. So most patients describe it as a quick pinch or like a little mosquito bite and then a wave of relief. It's not really numbing, it's about rebooting the body's communication system so the organs and immune systems can heal and they can hear and talk to each other. Yes, it's uncomfortable. We go really, really fast, and everybody says, I didn't know how much it was helping until I was away from the office for a little bit. We get requested for this treatment all the time. Another question is, how do I know if my immune system is too weak or if it's the opposite, is overactive? This is one of the key ways to treating Lyme effectively. If the immune system is weak, you'll see recurrent infections and slow healing. If it's overactive, you see inflammation, pain, allergies, and autoimmune type conditions. We use blood tests like a complete blood cell count, differential counts, inflammatory markers, and immune panels, but we also are evaluating your symptoms and your response to the treatment. Even use medical microscopy. It's our research design program of live cell analysis to see how your immune systems are behaving. And then I have people ask this. I've tried antibiotics and herbal therapies before. What makes your approach different? Now, the difference is we treat the person, not just the infection. There's no such thing as a Lyme protocol. There's a Jason protocol, there's a Macy protocol, there's a Jody protocol, there's a Jose protocol. And if you get the immune system, lymph system, and the nervous system, if they aren't in sync, the body can't finish the job. So our approach is to rebuild those systems while we help with immune nutrition, detoxification, protomorphogens, neural therapy. And then I get asked this, can the thymus and the spleen really be reactivated in adults? Or is that just theoretical? Sometimes in medicine, they'll say, hey, look, after you reach adulthood, the thymus doesn't work anymore. I don't believe that. Now, while the thymus does shrink after childhood, it doesn't disappear. And the studies show that with the right stimulation, like thymus extracts, protomorphogen therapy, direct peptide or biopeptide regulators, even neural therapy directly into this region, it can immune system training functions can be stimulated and your white blood cells work better. And the spleen responds the same way. Like once you reduce inflammation and help the immune system resilience, it dramatically increases in patients after targeted organ support. Another question is, I've heard detoxing can you make you feel worse? How do you avoid that? Well, the detoxing, if you do it too aggressively, like it stirs you up and you don't feel very good, but if you focus on drainage, this means opening the lymph, the liver, the kidneys, and the bowels. When the exit routes are clear, literally it helps to get things going out instead of reabsorbing. Like you don't want to stir up a clogged toilet and then not get it to drain. And most patients feel better, not worse, when it's done for therapy. Another question, how long does it take for your program to start seeing results? Well, it depends on how long the body's been under stress. Some patients start to feel improvement within 2 or 3 weeks. Others, deeper neurological or immune repair can take several months. So I tell my patients to plan for steady progress. It's not an instantaneous change, but the goal is lasting health, not a short-term improvement followed by a relapse. And then the last question that we have on this is it something I can do far away, or do I have to be near your clinic? Well, we work with patients all over the country. We start with a virtual consultation, review your labs, find out what treatments that may have helped temporarily, it didn't stick, or we need to do a personalized plan, and many components like nutritional therapy, detox, and supplements. You can do those at home. We have a plan, whether you're across the street or across the country, and then we can schedule some in-person consultation or even in-office visits. And then sometimes we'll work with patients to design an advanced therapy as IVs and neural therapy on a provider that is close to their home. Each patient is a little differently. We'd love to help you get started. My goal is to help as many people as possible to beat Lyme disease. So you go to our website, we have a free ebook. It's the Lyme Fighter Guide. It's at www.lymefighter.com, lymefighter.com. What we can do is we can help you get started on a program. We have a free ebook and free resources there, as well as the ebook. And there's so many neat patient success stories right here on this channel and on our website, on our blog, on our website, that shows that, hey, this isn't our first rodeo. We've helped people just like you to get better. Dr. West here, helping people to beat Lyme disease. Be aware that we're going to release videos consistently to help people know what their options are and to show people the success stories of people just like you that are no longer their disease. Now, thanks for watching, and I want to see you in the next video, but I also want to tell you about the special weapons against Lyme disease and how your immune system, thymus, and work together. You can see it on the video right here. We'll see you guys on the next video.